You're listening to Monday Science Podcast, the show that brings you the latest in science, technology, and health with your host, me, Dr Bahijja Raimi-Abraham. Happy Monday. Welcome to Monday Science, which is now available on Spotify, Apple Podcasts, and Google Podcasts. So hello to our listeners from these platforms. You can also send in any questions that you may have to mondayscience2020@gmail.com. Or you can submit questions through the chat function on our website. And following on some really positive feedback from last week's episode, you can also submit a voice message or your question in form of a voice message. And the details of this are on the website. So that's mondayscience.wixsite.com/podcast. So in today's episode, we are discussing retractions. There's over the last few months, and in particular last week, there have been a lot of retractions on publications related to COVID. On June 5th, so a few days ago, 3 authors of the paper, this is the title of the paper was Hydroxychloroquine or Chloroquine with or without a macrolide for treatment of COVID-19, a multinational registry analysis. 3 of the authors of this paper have retracted their study. The authors have stated that they were unable to complete an independent audit of the data that was underpinning their analysis. And so as a result of this, they've concluded that, as they said, they quote, that they could no longer vouch for the veracity of the primary data sources. Now, the interesting thing is that their study was published in The Lancet, which is one of the oldest and most respected medical journals or scientific journals in the world. And this is a very, very big deal because there's been this surge of publications on related to COVID-19, and the questions on the validity of the work and the studies have, it's been a lot. And so I thought it would be important to give some context as to why this retraction and other retractions have such an impact on the scientific and medical community, and actually other areas. Retractions don't just happen in the scientific world. It can happen in any areas of research. But more importantly, retractions of COVID-19 related work is particularly important at this time. And I will also give some examples of other retractions and their impacts impacts in their respective fields. Somebody wants to publish their research findings, they tend to do so in what's called a peer-reviewed journal, such as The Lancet. And there's a pre-publication review process, and this is where manuscripts or articles are reviewed and critiqued by colleagues in the field before the article is accepted to be published in that journal. And there are typically 3 reviewers, sometimes 4, for each manuscript or article. And this process is overseen by the editor of the journal or the special issue. In some cases, the editor sometimes they can override the decisions made by the reviewer. Anyway, so once the paper has been reviewed and the authors have made the suggestions that were suggestions, and sometimes this can be twice, like a 2-step process. So the paper's submitted, it's reviewed with the reviewers providing comments, and then the authors address those comments. And then usually at that second point, the reviewers can accept or say, actually, further work needs to be done, and the article should be rejected from the journal. But usually it only requires 2 sort of reviews, and it's accepted and published in the respective journal. And in a way, the peer review stage is sort of like a gateway stage, which is meant to help question the integrity of the work, highlight any issues that the authors can address, or it's not necessarily meant to be a negative process. It's meant to help improve the work and getting feedback, the authors getting an opportunity to get feedback from key people in the field on their work. And so after a manuscript is published, manuscript is published, then the process of peer review actually continues as the publication is being read. So this can be termed or thought of as a post-publication review stage. And in that circumstance, readers would often send in letters to the editor of the journal or correspond with the editor. These are then published, and actually those are also reviewed as well. And if it's a letter or a correspondence to the editor, then the editor would be the one that reviews those that are sent in. So let's talk about a journal itself. There's a metric that's used to measure the importance, the rank, and the impact of a journal. And this is referred to as the impact factor. So the impact factor is a measure of the frequency with which the average article in a journal has been cited in a particular year. And so generally speaking, the higher the impact factor, the higher the impact of the journal. And this can vary in terms of what is deemed to be a high impact factor journal. That can vary in different fields. And so the top, I'm going to give an example of the top journals in science and health. And just to say, the impact factor range goes from 0 to, whatever number. So for example, if we say 0, a journal with a 0 point something impact factor would be classed as quote unquote maybe having a lower impact, or it could be that journal is in a very small field. That's also what it could mean there. So in science and health, the top journals are Nature. So Nature has an impact factor of the publication has an impact factor of 43. Science, that has an impact factor roughly of 41. The New England Journal of Medicine, that has an impact factor of 70. The Lancet, that has an impact factor of 59. And then there are lots of, so like the Lancet and Nature, they are actually a publishing house. So there's like the Lancet family of journals or the Nature family of journals. And they also have relatively high impact factors as well. And the COVID-19 articles that have been, they've been published in several different journals, but actually a lot of them have been published in high impact factor journals, such as the Lancet Infectious Disease, which has got an impact factor of 27, and the Lancet, which I've mentioned. Interestingly, actually, the journal with the highest impact factor that I've come across is it's a cancer journal, and it's an impact factor 223.67. It's very, very impactful. So as a scientist, where we publish, I should say as a researcher, sorry, because it's also expands to different fields. So I would say as a researcher, where we publish in terms of impact factor and number of publication citations. So that's how many times somebody has cited your paper in their work. Yeah. So the impact factor and the number of publication citations is used to calculate a value called the HIndex. And the HIndex is an author level metric which attempts to measure both the productivity and the citation impact of the publications of an academic. And it can be viewed as it can be viewed as a numerical indicator of how productive and influential a researcher is. So for example, if an academic or a researcher has an HIndex of 17, then that means that person has published at least 17 papers, which has been cited 17 times. There's lots of questions about the HIndex being used as a metric for productivity and influence, but that's for a separate conversation. But it is actually difficult to compare the HIndex or H scores of a researcher or an academic across fields, because actually in some fields it's quote unquote easier to have a higher HIndex compared to others. So let's talk about retractions. A retraction is when a published paper in an academic journal is removed from the journal, and it is actually a big deal. So a retraction can be initiated by the editor of the journal, the authors, or sometimes even their institute. It can be the other people in the field, so other experts in the field that have challenged or questioned the work. And in some cases, it can actually be the public. There's examples of when somebody published a piece of work. I'll find details of it and try and see if I can put a link on the website. But somebody published a piece of work. It was in what we call an open access journal. So everybody has access to this journal. You don't have to pay a subscription. And there was an uproar on Twitter, and it had to be retracted. And so retractions in some cases are accompanied with an apology for the error. Maybe in the cases where the authors hadn't spotted it, but somebody, a colleague in the field, sort of an expression of gratitude to the person who had disclosed the error. A lesser withdrawal of content than a full retraction could be a correction. So this is where work has been published and there's still some credibility to it, but maybe there just needs to be a correction and sometimes it's even something as like small as, maybe the caption of the figure was wrong. So it's just like, I just want to state a correction in this, that, and the other. So retractions can occur for a variety of reasons. Error is usually the most common. Fraud and misconduct can occur, and as I mentioned already, public response to the article. There's a really, really interesting blog called Retraction Watch. I'll put the link in the episode description. And they provide an update on new retractions and discuss general issues in relation to retractions. It's a very interesting platform. And last week, it wasn't last week, episode 3, I talked about stem cells. And there's a well-known case of a retracted paper that was due to fraud and misconduct around stem cells. So in 2014, there was an article by Haruko Obokata and a team of authors. And they were the article, there were actually 2 articles, and they were discussing something called STAPs, those STAP cells, which is a method of inducing a cell, so a normal cell, to become a stem cell. And it was found that the work that they'd published had been falsified. And Dr. Obokata and the authors, they published 2 articles in Nature. So remember I said Nature is a high impact factor journal. And these articles were later retracted that year, so later on in 2014. It generated a lot of controversy. And unfortunately, later on in the year, August 2014, Obokata's mentor and co-author, Dr. Yoshiki Sasai, he unfortunately committed suicide. He'd been cleared of misconduct, but had also been heavily criticized for inadequate supervision of Obokata. And the perception was that he hadn't supervised her well. And so, in the Japanese media, he was really, really criticized, and people were reflecting on his responsibilities as her supervisor on the papers, and they started delving into his personal life. It's very, very sad. A lawyer that was working for the family said in a press conference that in the suicide note that was left by him before he took his life, he blamed the media attention around the retraction of the papers for his suicide. There are other examples of retractions. There's one 2019. There were several papers that were written by an American anesthesiologist who's called Professor Scott Rubin. And he'd published papers from 1996 to 2009, which were later retracted after it was discovered that he'd never actually conducted any of the trials that he had claimed to run. In 2010, he pleaded guilty to 1 count of healthcare fraud. And it was also alleged that he obtained a lot of grant funding for research that he never conducted or published. There are lots of other cases, not so extreme. Some of the cases are just the papers retracted because there was errors, or maybe there might have been some manipulation of data. And so there's a lot of consideration like ethics around retractions as well, because if, let's say, somebody spots an error in their work, then whose responsibility is it to then say this, we need to actually say that this is wrong, or we flagged up an issue? and it's a big there's lots of discussions like the ethics and the ethical dilemmas of publishing and of just conducting research, because when a paper is published, you're trusting that it's gone through due process. You're trusting, even in the first instance, that it was conducted ethically. The data, we can trust the data. And so when a paper has to be retracted, it really is a big deal. So bringing it back to COVID-19, well, so far there have actually been 15 papers on COVID-19 that have been retracted. There are two that have been, in addition to the 15, two that have been temporarily retracted, and currently there's an expression of concern for one. I'm going to put a link to the articles, or to the list of the articles, so you can have a look. But the retractions have ranged from studies related to COVID-19 epidemiology, clinical effects in China, to the combined use of hydrochloroquine and azithromycin use in COVID-19 patients. So it's a range of studies that have been published that would have already, because of how fast-paced research is ongoing in this area, and how, because we don't understand, or the understanding of the virus is limited, so any publication that comes out contributes to people's understanding. So there's an element of having to trust that data that comes out to then say, oh, we can use this understanding that somebody has had to try and find treatment, to try and develop a vaccine, to try and understand why certain demographics are experiencing or more prone to COVID-19 than others, or even the underlying risk factors. So far in June, and bearing in mind June, we're only, at the time of you listening to this, we're only going to be 8 days into June. But so far there have been 3 retracted papers. So the one that I mentioned, so that was hydroxychloroquine or chloroquine with or without a macrolide for treatment of COVID-19, a multinational registry analysis. And then the other 2 there's the second one is effectiveness of surgical and cotton masks in blocking SARS-CoV-2, a controlled comparison in 4 patients. And the third one that's been retracted so far in June is cardiovascular disease, drug therapy, and mortality in COVID-19. So there's a big concern about research research misconduct at this time, because there are a lot of researchers, journals, and even institutes that are very keen to be the first to report something about COVID-19. And this raises some serious questions around the way in which the data underlying these papers have been published and are being evaluated, and the implication and the impact of these papers, these retracted studies, could complicate the efforts to trial treatment, in particular during the pandemic. Thanks for joining us this week on the Monday Science podcast. Make sure to visit our website. Details are in the episode description, where you can subscribe to make sure that you never miss the show. So catch up with you next week. Bye.